So a couple of things that I'll sort of touch on first. So, and again, it's quite nice to actually hear everyone together. I'm sure as the questions start coming through the discussion, you'll start to see some of the themes. And what's nice is we have independently gathered all this information as representations across the globe. And it's really nice to actually see a lot of the crossover that's been sort of discussed from the group as well. So just to first say, obviously what I'm going to be talking about today is the Western Europe and UK perspective on this, and just in very few minutes, just giving a bit of an outline as to what we've found so far. So some of the key things we found when we've been looking particularly at public health and law enforcement joint approaches and work is that there's been some really key areas of focus. And this has tended to be on violence prevention with a focus on child exploitation, a very recent kind of push due to some activities in the UK around violence against women and girls. I think seen globally as well, along with the LAPH conferences around this trauma-informed practice and approaches, which has really opened up public health approaches within law enforcement. Alongside that, what we've seen as well, particularly from a UK and Western perspective, is this really push from a multi-agency and partnership working. And we've seen this through at all levels, from a local level all the way through up into sort of more broader national levels across government. And I'll talk a bit more about that in a moment. A key thing that I think everyone's been talking about so far as well, and I'm sure you'll see from the other panelists today, is around mental health responses. And that's probably been one of the key drivers, again, around where we really do need to have those joined up approaches between public health and law enforcement. And I'll be touching on some of the projects that we've seen around this. And again, reflecting on what Mo was talking about before as well, about some of the diversions and some of the more early help schemes around substance and alcohol misuse. So what's key is when we've kind of gone through a lot of the projects, and what we've done has been gathering projects across Western Europe and UK. These are kind of the key themes and key areas that have been coming out, that have been focused, which I think is interesting in itself. Now, what seems to be working well, and what I've kind of done here is kind of combined what is working well and some of the drivers around this as well, is that, and you hear this a lot of time over many years of coming to these conferences, that there certainly is an awareness and acknowledgement that you cannot west your way out of this. And this is seen at all levels, from those on the ground all the way up to those sort of even senior politicians and ministers that are there. I talked before about kind of buy-in and this kind of joint working, and certainly from the UK perspective at the moment, what we're seeing is this kind of real buy-in from cross-government ministers and leaders. Literally this week, last week actually, because it's Monday today, there was one of the presentations I went to at minister level, and we had the ministers for serious, looking at serious violence with both the health, the police and Department of Education all sat around the table driving some of the agenda forward around how we look at serious violence and opening up conferences. So really actually having that physical, visible buy-in, as well as some of the financial joined up approaches that are happening now. Again, what's working really well is this push on changing language. And this really does help to change culture and traditional responses and silo working. So really encouraging people to think more broadly. And again, that has come from a lot of the joint funding work and some of the initiatives that have been pushed from government and from senior level out into some of the smaller projects and initiatives that are going on, really trying to buy into this language, which is more around sort of early help and more around really understanding some of the problems that exist in communities. Again, and I think this has been talked about by both panelists so far, is around this acknowledgement and need for evidence-based and evaluation. There are some limits within this, which I'll talk about in a minute, but certainly what we are seeing is this question about what does it show, where are the benefits, where does it work, where does it not work, under what conditions, and a lot more rigor and a lot more expectation, if we're honest, around funding going forward about how this works. And another great thing that I think we're seeing across Western Europe in particular, and certainly within the UK and some of the smaller projects that were initiatives locally, is around this user voice. So asking the question about where is the user in this, where is that co-creation model that's working. So really posing those questions. Coming to the problems and challenges, and this really does reiterate, particularly Mo's opening presentation, this kind of postcode lottery and around time constraints is certainly a key issue. And it's talked about a lot, particularly within the UK, around how you can just be in one different postcode and actually servicing the provisions that exist around that according to funding can be very, very different. And again, some links around sort of poverty and demand and problems with some areas getting additional money compared to others. A key thing again that was talked about previously was around this idea of data and databases and sharing. And I think this links a lot with what we've seen in some of the projects we reviewed is around, again, I suppose some of the disadvantages of having senior government and minister sort of level buying into some of the projects, and funding around this is what ends up happening is some of those indicators, some of those measures are very short term. And actually might not reflect the reality of some of the softer and more effective work that's going on in the ground, and can actually really impact on funding going forward. So it's about how do we challenge some of the way that indicators and measures are being forced upon a lot of the funding of projects that are public health and law enforcement collaborative work. It's a real question I think we need to be pushing back onto some of our funders around this. Again, linked with that, I suppose, is around some of the targeted funding and interventions as well. So the danger of only having sort of really targeted funding. So, for example, in the UK, we've got a number of violence reduction units that obviously have a specific remit around reducing violence. So what happens to anything that doesn't fall within the remit? Does domestic abuse come into that? Does it not? How does child exploitation feature within that? So again, sometimes just asking about some of the very targeted funding, and again, reflecting on what Mo said before, but actually missing some of the stuff that sits underneath that might be a problem within that. And that's some of the stuff that's being talked about in evaluation findings from some of the work we've looked at. And just reflecting on some of the removal of universal services. So when I talk about universal services, we kind of talk about those places where our families and our children all are there and or tend to experience. So whether that's school, really, family healthcare, maternal checks, community support and safe spaces, and particularly within COVID, this is an issue going forward. A lot of those things have been stripped back. We're trying to catch up on what's going on at the moment in terms of education and getting back into a financial stable world. But actually some of the communities, some of the safe spaces and those really universal services have really been stripped back. And then lastly, again, reflecting on some of the language, where there is a commitment, there is an understanding around language change when we talk about, and again, reflecting on the presentation before around, talking about sex workers and exploitation. Certainly within the UK, we've seen a real, I suppose, transformation from language and treatment for our child sexual exploitation, not talking about sex or prostitution, but talking about rape, talking about exploitation. But we're still, for example, if you look at child criminal exploitation, there are a number of issues around that still being seen as a child, a young boy, being a perpetrator. And again, just I'm sure this is reflected in all of the presentations today, this need for seeing the reports with the same findings all the time, but actually the inability for this to make action and change. I won't go on too much. I've put some hyperlinks there and I'm sure we'll make the presentations available, but I've hyperlinked some of the projects that are available for you to go and have a look at across Western Europe. So we've got some stuff around the Netherlands included in this, the Wales Violence Prevention Unit, some of the work that's happening across Scotland as well. And again, the co-responder models is certainly something we're seeing in Western Europe and UK for the domestic abuse and for the mental health cars. And we've got a lot of these people actually presenting across the conference over the next few days. So I'm sure you can catch up with some more detail there. But that's everything from me.